Welcome to Airway Answers, expanding your breadth of knowledge. My name is Nicole Goldfarb, and I'm a speech-language pathologist and certified orofacial myologist. And I'm here to help you find your airway answers. We're in this together. Let's do this. And hello, everybody. Look who we have today. We have Dr. Howie Hindin. How are you doing today, Howie?
I'm great. I love your little video. That's great.
You're the first one I've done that video for. So it's pretty fun. You got a lot of cheers from the audience there, right?
Wonderful.
Well, thank you so much for being here. So I'm going to go over your bio and then we'll get into some great conversations. So Dr. Howie Hindin is the co-founder of the Hindin Center for Whole Health Dentistry. He's a graduate of New York University Dental School and a pioneer in the field of integrating the medical and dental needs of patients. Dr. Hindin was one of the first practitioners to eliminate the use of mercury filling from his practice, which is really cool. I think I have one more of those left in my mouth, so you can tell me how bad that is later. Dr. Howie Hindin has had the honor to serve as president of the Foundation for the Advancement of Innovative Medicine and is the founder and president of the AAPMD, which hopefully you all know about, the American Academy of Physiological Medicine and Dentistry, which we're going to talk about today. He has had the opportunity to co-treat patients of the leading practitioners of complementary and integrative medicine and advance the concept of medical-dental collaboration. He is the co-author of GASP, The Hidden Path to Wellness. Hopefully you have all read the book GASP. If not, I urge you to get that book. Very important, innovative book. I think about 2016 that was published. Dr. Hindin is one of the first dentists to utilize acupuncture in a dental practice and has been a certified acupuncturist since the 1980s. Dr. Hindin, I did not know that. You are a certified acupuncture practitioner. We got to talk about that too. Dr. Hindin has served on the board of the Acupuncture Society of New York and the New York Dental Acupuncture Society and created and directed the acupuncture program for substance abuse for Rockland County. Amazing. How did I not know that? That is so cool.
You got to keep some secrets.
That's like a big secret. We got to talk about that. Oh my goodness. Because we have an ENT. He used to be in San Diego and he was the first and maybe only ENT that was an acupuncturist. And he started using acupuncture. He's a pediatric ENT when he did tonsil and adenoid removal on children and said that the treatment completely changed. And most of the kids didn't even need pain medication after. He'd have kids who would have to come back sometimes for like IVs due to dehydration because they weren't drinking and eating because of pain. And that reduced to almost zero after he used acupuncture during his tonsil and adenoidectomies. So let's just totally go off track from what I was going to talk about. Can you talk about the acupuncture and how you got into that? Because that's really interesting.
Yeah, somebody once said, wherever you are now, everything that you've learned before comes together to make you who you are today. So I'm old. I've been, I'm in my 83rd year and I've had a lot of experiences and some of them are like, this is weird. Why am I doing this now? But now, and I look back, everything has come together to play a role in what I do. I went to dental school. I love science. I was taught exactly how to be a dentist, and I graduated knowing everything I would ever have to know. Maybe I would take some graduate courses and learn more, but I found there was so much I was never told. And in fact, I probably was more open in my thinking before I went to dental school than the day I graduated from dental school, as most people are whenever they go to school, because you sort of narrow your focus. And then things came up. So you want to talk about acupuncture first? What would you like to talk about?
Well, I just find that interesting that you're like a legend in the field and all the organizations you've started and founded. And how did I not know that you are an acupuncturist and you use that in your practice. Yeah, let's talk a little bit about that before we get into like how that relates to dentistry and how that got started. And one quick thing, that's amazing how you kind of summed up that school narrows your focus and you're maybe more open-minded when people start their education in schooling versus when you graduate from school. And what's that saying? Like, don't let your education get in the way of your learning. And I think a lot of us in the airway field have stepped out of that trap and that narrow-minded focus. And we've kind of like, wow, our minds have been open with the things we've seen with our patients and our understanding of breathing and airway, that we're on this like path to continuing education, right? Our minds are open. So let's talk about that acupuncture piece before we get into other components. And no problem, if your phone is buzzing, you are planning for Collaboration Cures right now, which is like a month away, and you have so much to do for this amazing conference coming up.
Well, talking about learning, so in dental school, and this was a long time ago, and we still were taught mercury fillings at that time, and we didn't wear gloves and at that time, and we mixed the mercury and the silver powder together, and then we wrung it out with our fingers in order to squeeze out the extra mercury. And then they said to us when we started in the clinic, take all your jewelry off, your rings, because the mercury can pit it and ruin your jewelry. So I said, does that mean it's dangerous, that the mercury could be a problem? He says, no, it's not a problem. I said, well, how can it pit your jewelry and not be a problem? So he said, well, once it's in your mouth, it's safe. Mm-hmm. And so going back to what I said before, if you want to finish school and you want to get your degree, you have to buy into what you're told and not ask questions. If you ask questions, you could be deemed the troublemaker, and that affects you. So you really follow a path. And in my opinion, the people who get to the top become the heads of departments in professional schools. People who've been there the longest. These aren't people who are innovators who want to try new ideas. We try to get Airway into NYU Dental School, and they said, our curriculum is so full, we don't have any room for that now. We have more important things to do. And I'm thinking, like, what's more important than breathing? But anyway, so my acupuncture story. And I love to tell stories, so if I get too long-winded, you'll tell me. My brother-in-law was a physician, and we loved to do things together. And so there was a new thing called acupuncture that was for physicians and dentists. So we took a course together to become certified in acupuncture, 1979, 1980. And it was only like a weekend, 36 hours, but that's all you needed to become certified. It's like, how much can you learn that amount of time? But then you take more courses. It's sort of like today you can be certified in something related to airway in a weekend course. You can take a myofunctional therapy course or a laser course or frenectomy course and go out and save the world after one weekend course and buying whatever product they're selling. Anyway, so that's how I got certified, and I started doing acupuncture, and it really worked. It was like incredible. That there's one point on your leg which is called spleen 6, great for menstrual cramps. There's a place, it's like 3 fingers up from your ankle, and since women ovulate once from one side 1 month and one side next month, that leg that is sore is the side you're ovulating on. You one needle in there, and almost everybody, all cramps, all discomfort goes away.
That's amazing.
Every every person who's not post-menstrual, who worked, every woman in our office, whenever they get to that period, in fact, they look ahead to make sure that they're going to be getting their period when I'm in the office. So, but I said it's not rocket science. I can show you where to put the needle in. It's not a problem. Now, my daughter, who happens to be an acupuncturist, craniosacral when she was 15, 16, she was the one, she felt she was the last person in a class to get her period. And she said, when am I going to get my period? Everybody else has got it. What's wrong with me? I'm not. And finally she gets it. And then she said, how long does this last? How often, how many years am I going to have to put up with this? And so I did some acupunctures. I showed her how to do the acupuncture. Finishes high school. She's going off to college. And I said, here's a box of needles. Go and you can do it. A month later, she calls me and she says, I'm out of needles. I said, how could you be out of needles? I said, what are you doing, acupuncture for everybody in your dorm? I said, all right, just be careful and do that. But it was really good because she ended up being an acupuncturist and a craniosacral therapist. And
Wow.
and now you love this. She works mostly with women right before, during, and after birth.
Wow.
So she'll treat 1 week old babies with who are having trouble feeding, and sometimes and sometimes just doing the craniosacral therapy, especially if they've had like difficult births or forceps delivery, that really makes a difference. And she really believes you need to look at the cranial base and the cranial bones before you consider doing a frenectomy, because it's related. Which brings me to the idea that there is so many parts to the puzzle, and what I advocate, what my philosophy is, whatever you know, that's great, but you don't know everything. And the way that people who suffer with airway problems need to be treated is for each individual to have the fullest, best care, and don't become, if you're a practitioner, don't become misguided or egotistical because now I know something and you can help people. It's exciting when you learn something new and you say, oh my God, I'm helping people I wasn't able to do before. And in fact, I think probably people learn the most when they go through the process themselves. And I know you're a great example of that because, you've gone to school, you're smart, but all of a sudden you discovered you had a problem, and you went through a lot of different things and tests, and now you realized you become even smarter because you're smart enough to know what you don't know.
Yes. And the more you know, the less you know, right? It's like you're like, oh my goodness, this is overwhelming. But I know it's like everyone in my family, everyone I know seems to have a problem, an airway problem. How is that? But it's going through those experiences on your own that really do help you to understand and to feel what's happening, and then to also have those experiences maybe with your children or other family members. It's so true. Like you can learn from classes and coursework, but also having a personal connection to experiencing these issues, whether it's different types of sleep studies or different orthodontic techniques or dental techniques, or programs, really help to make you relate to patients and really let that sink in, that knowledge. So that's it's interesting. Tell me, how did you get interested in airway from dentistry to then airway dentistry? How did that happen for you?
So I've been doing TMJ treatment since 1968. You were just a kid then. And then started to learn about airway, and we did a lot of work with it was called at the time Vol acupuncture. It's looking at measuring different points with a machine, and then looking at how things are related. And I was always interested in neuroscience and physiology, how things function. Dentistry is a lot of dentistry is based on structure. Even how teeth meet and how we chew is based on work with dentures and not with teeth. And so when dentists do work, they put models on something called an articulator, but there are no muscles and airways and things related to that. It's just how things meet. In somewhere in the 90s, I developed something called atrial fibrillation. Atrial fibrillation is where your heart's not beating regularly because instead of one part of the heart originating the beat, there are all these other places that are doing things. And it was really uncomfortable. The weird thing was I could be fine all day long. I'd wake up after 2 or 3 hours at night with my heart racing. My heart rate could go up to 180. And I figured out the way that I could get it back into normal rhythm. I get up in the morning, I go to the gym, I get on a treadmill, and as soon as I got this treadmill up fast enough, I go back into normal rhythm.
Okay.
And in retrospect, it was because I was an adrenaline junkie.
Mm-hmm.
That as long as I had enough adrenaline, which helped keep my airway open, which so many people with airway problems are sympathetically upregulated, it would be okay. So then I ended up having a procedure called an ablation, where they go in and they find the places where your beat is irregular, and they zap it with electrical current. So in my case, either they used too much current or something happened, and they created scarring of my pulmonary veins so there's no airflow back to my lungs from my heart from my left lung. So I really function just getting oxygen from one lung.
And from the procedure?
From the procedure.
Wow. Okay.
So each lung has two pulmonary veins that send oxygen back to the heart. And so the two veins, both veins from my left lung were completely scarred. So I had no oxygen there. So at this major hospital in New York City, the place that does the procedure is called the electrophysiology department. One door next to the electrophysiology department is the sleep lab. And nobody ever said, before you do this, let's go and have a sleep test. Maybe you have a sleep problem. This was back in the 90s when it may not have been known. So, but, and then I finished the procedure. I had a bad outcome, and I still had my AFib. It didn't change. I started looking at sleep, and when I treated my sleep, my AFib went away.
What do you know?
Yeah, shocking. And
so they still don't pick up. You're like, this is the 90s, and they don't say go get a sleep study. 2024, they still don't. Like, I'll have you finish your story, but like similar thing with my dad, and no cardiologist ever said to get a sleep study still. But go ahead, keep going though.
So being a positive person, I said, well, the good thing, if you're going to have a problem with a body part, it's good that you have a problem with something you have two of, as opposed to something you only have one of, so I still have the other lung, and now it's 30 years later and I'm still here. And so I'm doing okay, but it really pissed me off that happened. And I say, one of my goals, I have two goals. One is that I'm going to outlive all my doctors. And the second is I will do everything I can that nobody else will have to go through the same problem. Not everybody who has a problem is it because of an airway sleep problem, but there are a lot of people who do. And what does it hurt to check that if it isn't hey, we've crossed that off the list and we move on to something else. But if it is, you can make a difference in somebody's life and really change them. And so, number one, screening has to increase. People need to look for it. What I've known over the years that as new practitioners, whether they be dentists, physicians, speech language pathologists, physical therapists, once you start looking, it's amazing. Like you said before, how many people you see who have problems. Or actually, what you said was, I don't see many people who don't have a problem. And I look at it like a car. A car can be fine-tuned like a racing car, or it could be not fine. It still gets you where it wants to go, but it doesn't get there as well. And cars are great because they work by mixing fuel and oxygen. That's what gets them to run. We work by mixing food and oxygen. That's what gets our cells to work. If your car makes a lot of noise and it bothers you, you can either take it in and be fixed, or you can turn the radio up louder so you don't hear the noise. But that's what some people do. They just distract themselves by saying, "Well, I don't have a problem. That it's not my problem." We go over a bump with our car, and our car gets out of alignment, and so our tires wear out faster. Our gas mileage goes down. Look at that's sort of like a person. We something gets out of balance, and the thing that's out of balance we don't see, but we see the results of that thing getting out of the balance. I have this great quote I came across by Desmond Tutu. We have to stop pulling people out of the water and go upstream and find out why they're falling in the water. And I was sharing that with Dave McCarty, who's a AAPMD board member and a pulmonologist, which we can talk about later. And I said, make me a cartoon. So we have a cartoon and we put it up on the website. And that's the same thing, that there are so many of the problems in our society with health are the results with imbalances that happen that later get expressed in other ways.
Mm-hmm.
And what gets treated are the expressions of that imbalance, which is an incredibly good business model for healthcare. Because once you treat and resolve an expression of a problem, I have a sleep problem, but I have high blood pressure. Hey, we have medication for that. Now, maybe you have high blood pressure because you're not getting enough oxygen, and your brain is saying, how do I get more oxygen? I have to increase my heart rate. I have to increase my blood pressure to push more oxygen through this restricted airway. But we're going to solve the blood pressure problem. We're going to give you a medication. And now you're normal. Then a couple of years later, you become diabetic. Don't worry, we have medication for that. We'll give you medication for that. And then I have brain fog. Well, we can give you something for that. And then which makes you more alert, but it makes you a little anxious. Don't worry, we have medication for that. So there's a continual goal to treat the expressions of the problem and not looking at the imbalances. What is great in what we're doing and what functional medicine doctors are doing is we're trying to uncover as many of the imbalances as possible. And you never can really be sure you have them all. And so you have to have a little bit of step back and say, what don't I know? Who else do I need to be part of the picture? That's why in the AAPMD we have these different sections and figure out how do we collaborate together. And I think that's what's unique about the AAPMD. It's not exclusive. It's an inclusive organization that everybody who believes that airway is important, vital, and overlooked needs to work together, not only to learn together, take this message out into the world and and share it with everybody.
Yeah, it's so true about collaboration, and not one person has all the answers because these issues are multifactorial. There is not one cause for any person that is this is the cause of your sleep disorder breathing or airway issue. There's usually multiple components. And I have so much to say. I'm like, where do I start? One thing is AFib. I think it's hopefully pretty well known that our patients who have AFib need a sleep study. Sleep needs to be investigated because there is a pretty direct correlation between sleep apnea, sleep disorder breathing, and atrial fibrillation. Is that correct?
Absolutely. It's one of the comorbidities, that and GERD.
Mm-hmm.
Because when you think about it, we go to sleep. It's a time where everything shuts down. We repair. It's time of parasympathetic comes up more. Rest, digest, restore, rebalance. Normally, our blood sugar goes down continually during the night. We wake up hungry. We're ready. We're ready for the day to go out and hunt to gather. But if we have these interruptions where, oh my God, I'm not breathing, and our brain has to keep jumping up, increasing our blood sugar levels because we think we're under attack. What do you do? What does your heart do? It speeds up, it slows down, it throws it into chaos, and this happens every night. And so it's just, when you think about how we function, these imbalances day after day, night after night, week after week, has to be a problem. That if you wake up in the morning and you don't feel pep and energy, and you need a cup of coffee to get started, or you're tired during the day, William Dement said in his lectures, father of airway, of sleep, said sleepiness is a red flag. In fact, in his classroom, if somebody falls asleep in the class and you wake them up, they have to get up and shout, "Sleepiness is a red flag."
That's funny.
But if you're not eating right, it. You can lie about it and you say, "Well, I just cheat occasionally." If you're not getting enough exercise, you can also, it, or you can lie about it or make up a story about it, but you don't know if you're not sleeping right.
That's the interesting thing, is a lot of people don't know you're asleep. Some people are well aware, I'm snoring, or their bed partner hears them snoring, or they feel they're gasping for air, or having these nightmares, waking up with a pounding heart. But some of the more subtle aspects people might not be aware of, like especially our patients with upper airway resistance syndrome, which I was a patient of that issue. And I honestly did not know, because it was all symptoms that led me to realize I have a problem. But I swear I lay back and go to sleep. I don't move. I don't snore. But on a sleep study measuring brain waves, and a PES sleep study measuring pharyngeal esophageal pressure, negative pressure in the airway, wow, I was running a race in my sleep, and my heart rate would go up to like 110. And so what I did is I hopped on the treadmill. Actually, I was on the elliptical, and I got my heart rate to 110. I took a selfie. I was sweating. Like I was like, that's happening when I'm sleeping, but I had no idea. So a lot of our patients or people just walking around in the world don't even realize they have a problem. And then we focus on symptom-driven treatment, like you talked about, not getting to the root cause, but treating symptoms. And I was just with my kids at the pediatrician on Monday, and we were talking about how someone in my family is pre-diabetic. And I said, that person has sleep apnea. And the pediatrician's like, to you, everything is about sleep. And I just had to just bite my tongue and just be like, yeah. And that kept spinning in my head for the last few days, because yes, it is. If you have sleep disordered breathing, your likelihood of getting anything that you have a genetic tendency towards or any, cardiovascular issues, it's heightened significantly, blood sugar issues like that. So it's just funny to kind of blow it off to say like, oh, everything is about sleep. Well, it is, right? Like, how would you feel if the pediatrician said that? It's all genetic.
Yeah, there are two things that I think that I find very important. One is if you have a sleep problem, the disease is sleep apnea. So when you go for a sleep study, they look if you have the disease, sleep apnea. But if you don't, then, well, you're okay. You don't have apnea. But when your brain is threatened, my airway is closing, there are two things that can happen. You can either fail and have an apneic event, or if you're not lucky, your brain is successful and it raises you from a deeper state of sleep to a lighter state of sleep that you don't necessarily wake up, but you have an arousal to a lighter stage of sleep. Physiologically, it's exactly the same physiological negative effect on your body whether you have an arousal. But in one case, you're okay. You don't have apnea. You don't need to worry because you're under 5. But your whole system is now having the same upstream problems as a person who has apnea. Women suffer the most because they tend to be not heavy. They don't have all the typical things, and they don't have apnea because they more tend to have arousals. My friend and co-author of Gas, Michael Gelb, said men are in denial and women speak in riddles. So men say, I come into the office, why are you here? My wife says I have a problem. Do you have a problem? My wife says I have a problem. It's not my problem. I'm here because, she told me that I have to come here. Women come in because they have anxiety. They have fatigue. They have the effects of airway disordered breathing and poor sleep, but they don't have the disease. I took a test and I don't have apnea, so they don't know that. But and so they often get untreated, undiagnosed, and treated for things they don't need to be treated for with medication, anti-anxiety medication. You have trouble sleeping, take a little Ambien or something like that, while their physiological imbalance is going on, creating other health problems down the road. So those are two of the things that I think are really important that I always want to concentrate on.
And I remember Dr. Stanley Liu, I took a course with him, and he said women are the most underserved population. So, women, these symptoms are kind of less blatant or are going to be maybe more likely to have that upper airway resistance syndrome and get missed. Dr. Simmons, who scores sleep studies with scoring criteria 1A, where that's how most sleep studies should be scored, where you don't need to have an oxygen drop to count an event as an event. You just need to have a brain arousal. And that's more difficult for sleep labs to characterize, for them to have to go through the sleep study and look at when the person is working harder to breathe, when there's increased negative pressure, did the brain arouse, or what happened right before the brain aroused, right? So most sleep labs are just looking at whether the oxygen level dropped 4%. So when I did my sleep study with Dr. Simmons, who used the pharyngeal esophageal manometry, looking at negative pressure in the airway, you are able to classify that as sleep apnea even without the oxygen drop. So before I started and did some airway treatments orthodontically, I had moderate sleep apnea, even though I didn't have any oxygen drops. So when you're using the correct scoring criteria, and I believe it's 2012, the American Academy of Sleep Medicine changed the guidelines for scoring sleep studies with the Rule 1A and Rule 1B, those women or people with UARS it can be called apnea, sleep apnea, even though it's not complete collapse of an airway with an oxygen drop. So it's just interesting how there's so many details and semantics and, subtleties in looking at what's going on. But what I definitely want to talk about now is we're talking about collaboration and how this is a team approach. We need ENT doctors, allergy doctors, dentists, orthodontists. We need our sleep doctors, our, acupuncturists, people working on, physical therapists working on the whole body. There's so many components. Can you talk about the AAPMD, the American Academy of Physiological Medicine and Dentistry, how you and Dr. Gelb started that, what the goal is? Tell us all about that, because I'm going to that conference coming up in September and I want everyone to come.
Okay, so very beginning, Michael Gelb and I were sitting in a diner having breakfast together. And we said, we should never have to treat the people we treat. They had problems. And it went, even before that, I said, Michael, how many people that we treat with TMJ problems do you think have an airway problem? He said about 50%. I said, I think it's more. My belief is it's 100%, unless somebody's had trauma where they had an accident or something. And then every time I would ask him, it would go 60%, 70%. We keep going up. But we realized that almost everybody who has a TMJ problem had an airway problem, number one. And then we realized that one of our greatest sources of patients as adults with TMJ problems were people who had 4 bicuspids extracted. It was amazing. I would say at least half, probably greater than half of people we see that we treat have 4 bicuspid extractions. And when you think about it, and it's amazing how knowledge evolves. Of course, you take out teeth, you make the house for the tongue smaller. There's no place to go but back. It's going to affect the airway. It's going to affect other things. So we said, let's see what we can do to put ourselves out of business. Now, that was sort of, we're not in our lifetime, we're going to put ourselves out. It was sort of next. So we, on a placemat from the diner, and I still have that placemat, we wrote down, okay, we're going to start an organization. We'll start a foundation. We'll write a book, and we'll invent an appliance, and that's what we'll do. So we created the AAPMD and later the Foundation for Airway Health. We wrote GASP. We're still working on an appliance that we've invested a lot of money to. But that was like 15 years ago. AAPMD now has close to 1,000 members. But more so than that, we have spawned a lot of other organizations, and people have gone off and done similar things. I think that the way that we're unique is this really big stress on collaboration. And then we think about all the different parts that need to be involved. I look at it like you're baking a cake or you have a recipe. If you're just missing one ingredient, you won't have the recipe. You'll make something, but it won't be the full completed dish. And one of the things we often overlook in collaboration is the patient. That we have to get away from we do things for or to the patient to we do things with the patient. I have learned so much from patients that somebody tells me something that is so weird. Like I think about it, I dismiss it, but then I hear it 2 or 3 or 4 times and say, maybe this is really something. When I was I'm really involved with mercury fillings, people would say, I hear radio stations in my teeth. I said, okay, that's good. But when you hear 3 or 4 people or more telling you that, then you have to say, well, maybe that's possible that something can happen. And so we're trying to create this organization, these meetings And the name of our conference is Collaboration Cures. And we have people from different modalities. Like this year, we have Mariana Roccabato. Mariana Roccabato is incredible, a physical therapist from Chile. I know him for 50 years. He used to work with Michael Gelb's father, Harold Gelb. And one interesting thing that you may not know that Mariana says, you take a baby, you hold them upside down by their legs, and their head should be straight. If it's off to the side, that's like a precursor to a later TMJ problem. I told you I have a lot of good stories.
Yeah.
And he said that one of the things you want to do is maybe not put the baby the same exact way in the crib all the time. So they're always laying the same with their head to the side, move it around a little bit. So things can exist from childhood. We have physical therapy. We're going to have a white flag event because in the world of myofunctional therapy, back in the 70s, I took a course in myofunctional therapy with Garlina, and we were doing functional orthodontics based on teachings of John Witzik from back then with these European appliances. And I had one of my assistant was trained in myofunctional therapy, just doing the exercise, getting the tongue in the right place. And then myofunctional therapy sort of fell by the wayside, and then it got revived. And now it's important. Everybody wants to own it. And really nobody should control a therapy. It's there for people to benefit from. And so we have speech language pathologists, hygienists, body workers. Everybody said, well, this is the way myofunctional therapy should be done. Who suffers? The patient suffers because so much energy is spent in competing who controls what. So this white flag event is to try to get representatives and people from different parts of myofunctional therapy in a room together. What can we agree on? Can we agree that we all want to make the airway better? Can we work together to support each other? If you're a dental hygienist, you may be the best person to help somebody going through dental care, orthodontic treatment. There aren't enough hygienists doing myofunctional therapy to treat every dental patient who needs it. But if it's feeding, if it's growth and development, if it's something you haven't been trained in, maybe it's better that a speech language pathologist or somebody who's certainly trained in that can do that. Stay in your own lane, but what are the lanes? How can we agree on what the lane should be like? Wouldn't it be great if everybody supported each other and said, I can handle this, but let me refer to somebody else who can do that? And go from the sea of competition to the sea of collaboration. In New York City, there's a diamond district. Diamond district in a small block area, there are hundreds of little jewelry diamond stores. And somebody said, well, wouldn't it be better to be the only store on the block? Then you get all the business. But it turns out people who come there look for something. Somebody said, well, I really don't have what you're looking for, but go two stalls down. They'll be able to help you. And everybody does well in that.
That's a good analogy.
Yeah. And so that's what we're trying to do. So that's going to be on Saturday.
Okay.
The other thing we have, which is another great thing, we have an improv workshop. Reno Improv. Alan Alda, are you old enough to remember Alan Alda Mash?
No.
God. So Alan
Right.
Alda was an actor on this really great TV show called MASH.
Okay, I remember MASH. Okay.
And so he wrote a book, and the title of the book was "If I Understood What You Were Saying, Would I Have This Look on My Face?"
Okay.
And because he had a bad experience, because things weren't, he didn't understand what was being done, and so he wrote this book, and so he developed a school of communications at Stony Brook College, and they teach communications for doctors and scientists using improv. Because when you're doing improv on a stage, you have to be so focused on what the other person is saying, their body movements, everything they're doing, so that you can respond properly. And often when we communicate and we have a great message about airway, we think about what we're going to say next, opposed to what they're going to say next, and we're trying to get them to a point, because and on our website, it's sort of structured as who we are, what we do, and how we do it. And I thought that was great, but what we left out is why. What is the why? And I always try now, I'm trying to ask patients when they come in, what's your why? Why do you want this treatment? That we know why we want our patients to have it. We don't know what that why is. So going back to what I said before, if a guy comes in and says, I'm here because my wife wants me to do this, that might be a different way you would treat them, or they may be less motivated if they say, I'm not breathing well, my blood pressure is up, I know that there's an airway connection. That's a different why. We need to look at that why. So you know what? The procedure that Alan Alda had done, that he started, that motivated him to write the book?
What?
Frenectomy.
Really?
He had a
When did
label.
he write this book? When was this? When did he write the book?
Oh, it's a couple of years ago. It's
Just a couple years. Okay.
a great book. But he had a space between his two upper front teeth.
Okay.
And he had the frenectomy. He said we can help close that with that. And so when he had that done, his speech and his lip position changed.
Okay.
He was always in front of the camera. Whatever that change was, he didn't view it as beneficial. And nobody told him that could happen. And so that was the motivation for the book.
That is so funny. So he's going to be at Collaboration Cures? No.
He would be if he didn't want $100,000 to be somewhere.
Right.
So, but we do have, but it's improv. And so we have a workshop on improv where we can practice how we're going to communicate and see how we do, where we can sort of clear our mind from what we're going to say next and just be open to hearing what somebody has to say.
Which is good for any field, for normal relationships. It's always important to listen.
And I'm sure that now that you've been doing this for the years you've been doing it, you hear so many interesting stories. And they play a role. There's so many people who have airway problems, who have repressed feelings, who have had some sign of abuse, and sometimes when you help them breathe better, it relaxes their autonomic nervous system, their sympathetic tone calms down. They start crying and they have all these emotional releases, that we carry. We have a box of tissues in every room. We never know what this is going to contribute. What's going to contribute to this?
Right. And people, when you stop and listen, people feel that connection. And a lot of our patients need to be heard because they've been living with symptom-driven treatment or living with symptoms without treatment and have never really been heard or gotten to the root cause of their issue. And when you slow down, listen, connect, empathize with them, that is where tears start coming. People feel like, wow, somebody hears me. Somebody knows that I shouldn't be living this way. Who
And
else
so,
is? Go ahead.
one of the things I try to tell patients is when they tell me stories like that, and they say, "You are fantastic, that you've lived and dealt with these problems instead of feel that you're defective because you've had these problems." I said, "You're not breathing well, and people who are not breathing well at night are not breathing well during the day." I have skied at altitude, 12,000 feet, and every step is a challenge. And I said, "You go through life, you work, you take care of your kids, you do things, and you're not breathing well. You're not defective. You're super.
Yeah.
That you're able to do this with this handicap. If we can help you remove the handicap, or let's say it's like walking up a hill with a knapsack full of rocks. We can take any of the rocks out, and our goal is to take them all out. Then your life will be so much better. But never think of yourself as defective, because look of what you've done with the problems that you've had."
Yeah, that's so true. And I just did a consultation with a patient who's working with one of our physical therapists, and she's 47 years old, four TMJ issues, four bicuspid extraction, wisdom teeth extracted. So she's missing 8 teeth, 3 rounds of braces, and she has pain, chronic, migraines. And she just said, maybe I feel so much better since I've been doing myofunctional therapy, but it's not cured. It's not completely gone. Like, should I just accept, like, this is how my life is? Like, maybe I just live with pain, but less pain. And I was like, no, living with pain is not an option. You are not supposed to be living tired, fatigued, in pain, with headaches. That's not okay. We need to get to the root cause. And I think she was very dissuaded initially because of all the different quote unquote treatments that this patient has had that weren't helpful. I said, we're here to guide you to the right people who can help you, who are going to look at this from an airway perspective versus, oh, let's retract your teeth more and all this. So I think the patient, she wrote the nicest email after that meeting. She felt she was heard, she was connected with, and she is going to continue to seek help because there's not one answer. Myofunctional therapy is not the cure. It's just one component. And I explained to her, research shows that myofunctional therapy can help reduce the severity of sleep apnea by up to 50% in adults. But that's not the one thing. There are more components, and you need to treat the other components. And I think our patients need to understand that. And the AAPMD really does elaborate on collaboration. There's a physical therapy section. Can you talk about at the conference the dates are September 12th through September 14th in Reno, Nevada. It's the kind of slogan is don't gamble with your patient's health because we're in Reno. And there's different sections. So can you talk about the different sections and some other people who are presenting?
Yeah. So you mentioned physical therapy. I mentioned Mario Roccabato. A couple of years ago, we started a pre-conference workshop, and I should mention, of course, that you have a physical therapist in the family.
Lucky for me, I
Yeah.
planned that.
who is a lot of fun.
Yes.
So we have a pre-conference workshop with Mariana Roccabato and the other half with Steve Warfel, and it's about how do you integrate physical therapy into your practice. When you think about airway, a lot of people don't know. We think about what happens from here up, but a lot happens further down. Our diaphragm, which we think is maybe just flat, really it curves up. So our diaphragm is attached to half of our ribs and also goes down to the psoas muscle. So it affects how we walk. So if we're not breathing well, or we're not breathing, our ribs aren't working properly, it could affect the way we walk and the way we stand. In our office, we always want to see the person walk. if the very first encounter with a new patient is sitting in a chair, we're missing a lot of information. How they walk and how they stand makes a difference. So that's what one of the things we're going to look at: posture, gait, movement. Can you stand on one foot easily? Can you stand on each foot equally? What happens if you close your eyes and you stand? Um, I work with Brad Gilden, who's in my area. We see so many patients together, and it's fun. I mean,
Yeah,
I've been
that sounds
practicing almost 60 years. I love what I do. So that's going to be great. And we just added. I'm adding one more breakout session.
okay.
My son, Jeff Hindin. He works with. He did some work. He made an appliance for balance for one of the world's skeet shooting champions, and it improved his reaction time by half a second, which in skeet shooting that's huge. So Jeff has now become a skeet shooter. Just last week he won 2 tournaments. He won 2 prizes for skeet shooting, and he's going to talk about performance, how you improve your performance from skeet shooting, golf. Golf and baseball is when in order to pitch or putt or swing a golf club, you have to shift your weight from one foot to the other. And if you're not as comfortable on one foot as the other, that shift throws everything out of balance. It's all about balance. So physical therapy is important. Myofunctional therapy used to be a branch of physical therapy. You know that?
No.
Everything, speech language pathology was part of physical therapy. And then as these things grew, it split off, and myofunctional therapy was the orphan child that got pushed off to different places. And now that myofunctional therapy has become so beneficial or valuable, everybody wants to own it back. Everybody wants to have it back. One of the other presenters, Phil Cooper, a African-American dentist from Savannah, AAPMD board member, but also involved with the NDA, the National Dental Association. National Dental Association is the African-American Dental Association, which was formed because until 1962, African-American dentists weren't allowed in the ADA. But they still maintain their organization because they feel the needs of some of their patient population are unique and different. And so people underserved community have airway problems too. And how do you address them? The best way to address them in a financially easy way is to start early with some of these appliances that are really inexpensive and myofunctional therapy. If you can get the kids 2 or 3 years old and change the direction of their growth, their breathing, their habit formation, that'll be good. Dr. Cooper says that most of us may change our bed littings every week, but in some of the people who can't, they do it every month. So in these houses, the dust mites and other allergens accumulate and kids breathe them in. They're not developing properly. They become mouth breathers, and they become they have allergens. Their nose gets stuffed, and they have problems. So there's going to be a breakout session where Dr. Cooper is going to talk about the unique needs of the underserved community, which actually shows up in reading scores and things. So there is so much for so many different people. We have ENTs, we have functional medicine, we have a lot about sleep, we have a lot about the oral systemic connection, microbiome. And if you are a practitioner who think, I'm not ready for this stuff, but It's everybody from just the curious who says, I don't know any about any of this stuff. You will learn enough to take home that will benefit you, to the advanced, to the person who says, I think I know everything, but you don't. We'll tell you
Right.
what you don't know. You'll be
Yeah.
amazed about what you don't know.
There is information for everyone to learn by attending this conference, no matter what level of experience you have. And I'm on the site right now, so I'm going to list some of the other presenters. Dr. Katwa, who's a pediatric pulmonologist. We have Dr. Karstensen. We have Laura Hopper, RDH. Peter Beckwith and we have Lauren Gates as the moderator for keynote. You talked
Well,
about
wait a
Mark
minute. Let me tell
Botto.
you. So our opening keynote, Steve Carstensen, Uma Katwa, Lauren Hooper, and Peter Beckworth is these are four people who have experienced airway and collaboration from their point of view, and this is going to be an inspiring. Dr. Katwa is from Harvard researcher, does a lot with pediatrics, but he also works with dentists, myofunctional therapists. Steve Carstensen works with everybody.
We all know him. Yeah.
And he's also our program chairman.
Yeah.
Lauren Hooper is a RDH, does a lot with oral systemic connection, microbiome. And Peter Beckworth is the owner and founder of Mad Rose Media, who helps practitioners develop their websites. So they all have the same belief, the importance of airway collaboration, but come at it from different points. So that, and Lauren Gates is wonderful. She's so passionate and vibrant, great moderator to kick off our event.
So great. That's going to be so great. I see Dr. Zaghi is presenting as well. Everybody should check out the website. There's tons of great presenters. It's this is really dorky of me to say, but it's like Disneyland for an adult airway lover who's in our field. It's like going to Disneyland for me. I'm like, I want to go here. I want to see this person and that. And then we have your
I'm going to back up so I can do the
back up for the Pulmonaut t-shirt. Let's talk about that. Now, Pulmonauts, can you tell us real quick of who the Pulmonauts are and when they're going to be presenting?
So we have a Friday night gala the Pulmonauts are going to be playing. So the Pulmonauts, I believe, is one of the greatest examples of collaboration. We have on the Pulmonauts, Jerry Simmons, who Nicole, you mentioned before, David McCarty, MD, Reza Moaved, surgeon, Brian Hockel, orthodontist. We have Samantha Weaver, SLP. We have Lauren Gates, who we just mentioned. We have Jen Kirkham, who also does practice development. And we have Greg Hyman, who also works for Mad Rose Media and is also one of my kids as a drummer. And if you would put all these people together in a room talking about airway, there is nothing they would agree on.
Oh, really? Okay.
I mean, there was something, but they would all, it would be hard to get
a great conversation. Yeah.
There wouldn't be good rhythm and music coming out of a discussion. But somehow or other, they've gotten together and they love playing together. They spent the last weekend rehearsing at Reza Moaved's house in St. Louis. There's a picture of them all on the roof hanging out together.
I saw that. A drone shot of them. How fun.
And you know Dr. Simmons. He never has time for anything because he's always so busy. He takes the weekend off to go up and practice. And so they've come together. I think their music is really good, but who they are and what they represent is really fantastic. We've also, as part of that Friday night gala, we also have created the AAPMD, diplomat status, where people can become for advanced standing. And it's going to be our first group of people who have achieved that status. It's only 3. Hopefully in a number of years, we'll have 100. And the eventual goal is that anybody who does anything with Airway can achieve diplomat status for whatever their practice modality is. But in addition to having to take a test to show their skills and what they know, they have to demonstrate a knowledge of who to refer to, a knowledge of how do you assess who you need to bring on board for the team of that particular patient, and show a desire to collaborate.
And is this, can speech pathologists, dental hygienists achieve this, or just for dentists?
No, it's going to be for everyone. It's going to be for myofunctional therapists, speech language pathologists, physical therapists, and everybody's going to have their own test in their area, but you have to demonstrate a knowledge. And we also think that you should be able to go out and teach not only to other people, but to the public in your area. Mm-hmm. So I'm working on a new little logo, light bulb, LIGHT, learn, implement, grow, heal, and teach.
That's great. That's really great. Yeah, I mean, it's so important for us to be part of these organizations like the AAPMD, attend these conferences where you feel so connected, I feel like, to your colleagues. Like, we listen to watch webinars, listen to podcasts, but to be there with everybody and also having fun, listening to the Pulmonauts and doing that, it's just a fun way to really learn, and then to, advance your knowledge by trying to achieve this status is really wonderful as well. And I'm a member of the AAPMD, and I probably listen to almost every single webinar. You have like hundreds in the queue.
251.
I probably listen to almost all of them as I go running. That's when I listen, and it's amazing. So I think it's such a great thing. I look forward to seeing everybody September 12th through the 14th in Reno. Hopefully everyone will attend the AAPMD Collaboration Cures. And thank you so much, Howie, for all of your knowledge, expertise, and everything you've done and you continue to do to advance the field. We just really appreciate it. Thank you so much.
Time goes by so fast.
It does. And I want to say a couple quotes just to summarize. I like to summarize things that we talked about. And we talked about this is what you said, whatever you know, you don't know everything. Very important. And the world of practitioners must increase screening for sleep disordered breathing. That just must be increased in all areas of healthcare. Our schooling might narrow our focus, but we need to actually go back and expand our focus and continue our education. You feel about 100% or nearly all of TMD patients have an airway problem. That is always important for us to know and understand. And I like your car analogy of talking about how, our body is like a car, and we need to really listen to issues that our body is having and not live off of a symptom-driven treatment, but get to the root cause, utilize our team members. There's a high comorbidity of AFib and sleep disordered breathing, and we need to that really goes back to increasing screening for sleep apnea and sleep disordered breathing. And thank you so much, and I will see you in September. All right?
Look forward to it.
Looking forward to it. Thank you. Thank you so much for joining this episode of Airway Answers. I'm hoping some of your airway questions were answered. Please feel free to give us a rating or a comment. And if you have any further questions, you're welcome to email me at nicole@airwayanswers.info or check out our site at www.airwayanswers.info. Thank you so much, and join us for the next one.